Welcome to Plastic Surgery TNA. That's Talking Advice. I am your host, Earl Stephenson Jr. I am an Atlanta board certified plastic surgeon with nearly 20 years of experience. In today's episode, we're going to talk about something that's fairly popular. It's been around for a while. They're called, or the procedure is called, thread lifts, sometimes known as a lunchtime facelift, but more formally known as a PDO thread lift. That's the official name. And this is really an intriguing procedure. And I think we need to ask a question about this procedure. I want to ask or pose the question: is this a quick fix for sagging skin, or this is just an overhyped procedure which will eventually lead to disappointment for our clients? That's the question I'm going to pose. I'm going to be a little bit biased. I'm kind of give you a little preview. I believe thread lifts offer some significant drawbacks, and we're going to dive into it. And this is how we're going to do that. We're going to first discuss what is a thread lift. Then we're going to pivot and talk about the pros and cons of thread lifts. We're going to talk about what makes thread lifts controversial. And then finally, we're going to talk about comparing thread lifts to other facial rejuvenation procedures, such as Botox, fillers, and then the ultimate procedure, which is a facelift. Before I get really into the meat of it, I want to stop right here and say, if this is your first time listening to my podcast, visiting my YouTube page, thank you. I really appreciate it. I want you to do two things. I want you to like and subscribe, and then share this content with your friends and family. If you are returning, welcome back. I really appreciate the support. I want you to do one thing. I want you to share this information to your friends and family. With all that business out of the way, let's talk about what is a thread lift. So, a thread lift is a procedure that's done in the office. It requires no general anesthetic. And basically, it is the use of a thread or stitch or suture that's placed underneath the skin so that that stitch can capture or snag the undersurface of the skin, because that stitch has little barbs, almost like little fishing wire, that will catch sagging skin. It's typically used in areas that sag: cheek, jawline, and neck. And it helps reposition the sagging tissues so that you have a more youthful appearance. So that's basically a thread lift. The stitch or the thread that it's used is dissolvable, so it's not permanent. The appeal for this is, hey, you don't have to go to surgery. That's the first appeal. Two, some people get really freaked out by general anesthetic. General anesthetic is really, really safe, in my opinion. If you want a deeper dive in that, I invite you to watch one of my special episodes where I talk with Dr. Mike Kissel a bit about anesthesia. He's an anesthesiologist and a pain management physician. But let me get back on track. It doesn't require general anesthetic. It's an instant effect. So you don't have to wait for the result to kind of evolve over weeks or months. And so everybody likes an instant result. So that's an appeal for a thread lift. Lastly, it doesn't really require a lot of downtime. It may require you to kind of lay low for a couple of days, and then you can get right back to your usual daily activity. Unlike more invasive procedures such as a facelift or neck lift, it's really going to cramp your style for several weeks, maybe even a couple of months. So that's a thread lift, dissolvable stitch, office procedure, takes about an hour, helps reposition saggy skin of the cheek, neck, and jawline. What are the pros and cons? Because it sounds a little too good to be true. So we're going to give it credit where credit is due. Again, it's minimally invasive, doesn't require incisions, cutting, any of that. It's relatively quick. Like I said, it's often completed in the office in about an hour or so. So that's the first pro. It's minimally invasive. The second pro is that the results are instant, as I mentioned earlier. The effect of lifting can be really seen immediately. That gets people really, really excited. And the recovery time, the last pro, recovery time is short, couple of days. So those are the pros. Here are the cons or the limitations, in my opinion. It's not a long term result. It's a somewhat long climb for a short slide, meaning the results are really short lived. They last about, if you believe the literature and you know, look at patients or talk to people who've had it, last about a year, year and a half. That's really opposed to a facelift, which is the ultimate procedure, which can last 10 years or more. So it really has short-lived results when you compare the two. Just like any procedure, whether it's surgical or non-surgical, you can have complications or there are risks. So that's the second con. Those risks are kind of unique to PDO thread lifts or thread lifts. You can have visible wrinkling underneath the skin. You can have kind of uneven or asymmetric skin. You can get infections. You can even have these threads or these stitches break, which require, you know, another procedure or another thread lift to kind of reposition the tissue. So that's the second limitation, complications and risk. Then the third limitation is, the outcomes are kind of unpredictable. It really depends, or the outcome depends on the patient's, age, their skin condition, and really where the rubber meets the road. Like any procedure, it depends on the skill of the practitioner or the surgeon. So again, unpredictable outcomes, and those unpredictable outcomes can have patients with, leave patients, let me say that, disenchanted. So those are the pros and cons of thread lifts. Now here's the controversy. You know, some people believe perception is reality. So we're going to talk about reality versus marketing. There's a lot of hype around these thread lifts as being more cost effective, or let's just say cheaper than as a non-surgical treatment versus a facelift. Facelift is a costly procedure because you have to factor in the surgeon's fee based on his or her skill, experience, geographic variables. It costs more on the West Coast than maybe it does in the Midwest. So you have to factor that in. It talked about being, non-surgical, which can be kind of misleading. It can be misleading because you basically have patients expecting dramatic results from the marketing. It's cheap, it's non-surgical. I think people kind of somehow take the leap of faith, saying that it's going to be a long-term result like a facelift. So marketing really doesn't really dampen that down. It really doesn't speak against that. It kind of lets people kind of get wound up in their mind that this is going to be a long-term result. You get a lot of patients at the end of the day that have these procedures done, the thread lifts done, and are happy for a while, but really at the end of the day, when they kind of factored everything in, they're really not very happy, I would say at least. And a lot of them are just frankly dissatisfied because they believe the hype. I came in over lunch, it was done in an hour. I'm getting a lunchtime facelift. So it sticks that facelift, word to the marketing, which implies again long-term results. And fast forward a year later, they're right back where they started. So it really leads patients to become disenchanted, you know? So that is a controversy of how that's marketed. And then there are kind of divisions within our industry that leads to controversy about thread lifts. Some people, let's just call non-plastic surgeons, really tout PDO thread lifts or thread lifts, mainly because, in my opinion, they're not trained. Let me put it that way. They're not trained to do a facelift. So they're never going to offer you that option. They're going to offer you what they can do or what's in their bag of tricks. So they're going to lean heavily toward non-surgical treatments such as thread lifts. So those non-plastic surgeons are really going to fight for that. Plastic surgeons can be split. Some believe in PDO thread lifts or thread lifts, but I believe the majority feel that it's not the best option for most clients that we see. So they're going to be on the opposite side of that. They're going to kind of go, I don't really dig thread lifts, so it's not really a thing. So you've got experts in cosmetic or aesthetic surgery that are divided, and that confuses the public. So that leads and fuels controversy. So these can be controversial due to marketing versus reality. That's kind of the general sense. The reality is that they're short lived, that surgeons and other aesthetic practitioners are split down the middle as to its effectiveness, and that patients ultimately are dissatisfied because of the lack of long-term results, but it is marketed in just the opposite, that this is something that's widespread in every aesthetic surgeons or aesthetic practices uh, office, and that this is quick, painless, with great long-term results, and everybody's happy. So those things lead to controversy. So really, if you're considering this, really think about those things as you try to move forward to make the best decision you can for you. So what are the alternatives? If you thinking you don't really want a facelift, but I've kind of scared you a bit, and you like, I don't know if I want a thread lift either now. So what do I do? So there are alternatives. You can have non-surgical options such as fillers. Juvederm is a brand of filler, just like Restylane is a brand of filler. And these fill in volume. A lot of clients, as we age, lose volume, which causes the skin to kind of drop and deflate. And you can add back that volume in the cheek, sometimes in the jaw, rarely in the neck, in my opinion, to kind of reinflate the face to make it look lifted to a degree and more youthful. You can use Botox to help with active wrinkles, especially the forehead, crow's feet, brow. There's some off label uses in the corners of the mouth to kind of give you a little bit of a lip lift. You can use them for neck bands to kind of give you a more youthful looking neck. So those areas can be treated with Botox. And also you can have skin tightening procedures such as radiofrequency or needling and radiofrequency. This is energy applied to the skin that allows the collagen layer to kind of tighten and give you a bit of a lift by that tightening. So those are alternatives to thread lifts that I believe are more time tested, have more predictable results. Every procedure has its limitations. I'm not sitting here saying fillers and Botox and skin tightening is better than a thread lift. It just can be applied, I believe, more readily or for a slightly larger segment of the population and can have a little bit more predictability in the results. A lot of times, these non surgical results are used together, not just individually. And together, they're certainly more powerful in the right candidate than just using thread lifts alone. Some people would even use thread lifts in conjunction with these other things. You have to individualize the treatment for the patient. So, again, all of these have merits, but you cannot use them in every situation. You have to draw upon all your experience. And that's why I believe being trained as a plastic and reconstructive surgeon, you have all these treatment options at your beckoning call based on your experience versus someone who's not, who may only be trained in a limited number of these treatments and can only offer you those treatments. So, combining techniques is important, really, really important. Of course, you can always, if you are again the right candidate, and have significant sagging of the skin and sagging of the muscle layer below the skin, which is the most important uh, layer to treat to help reposition those sagging areas to give you a more youthful look. A facelift will do that. A facelift, again, to me, is the gold standard for the right candidate. If you have subtle sagging, you may not be ready for a facelift at that point or ever. So again, maybe some of these other non-surgical treatments that I talked about would be reasonable. Even some people would say a thread lift would be reasonable. Again, I think they have too many drawbacks and not really the right thing to do in my hands or in my experience. But you certainly can do that. But a facelift, unlike a thread lift, lifts not only the skin, but the underlying muscle, which gives you more longevity and more power. And as I said before, it lasts longer. It can last up to 10 years plus. So it is an alternative. It's a more invasive alternative, but with more power and more staying power. So that's really, really, really important. I would say, in in my opinion, if you are considering a thread lift, sit down and talk with a couple of plastic surgeons and maybe even go to a dermatologist and just get the information and bring it all together and really listen to what they're saying and really look at what areas bother you and what you really want to have done. Because most clients want to be kind of one and done for the most part. And if you get really the wrong procedure, then it's not going to give you the results you want. And you're going to end up spending more time and more money going back and getting the procedure that you need. So it's really, really important that you sit down and make sure that you get several expert opinions about all these modalities and especially thread lifts. Last thing about thread lifts that I want to kind of touch on is I really want to harp on the complications again. Thread lifts can really cause some wrinkling of the skin that's hard to kind of correct. They can cause some infection, which can be really disturbing because they end up with red skin and sometimes blistering and draining areas. And sometimes there are allergies to these stitches that can cause red areas. Really, really consider that portion of your decision making process when you're thinking about having this done. I'm not here to poo poo it completely, but in my opinion, thread lifts aren't the best option. So, in summary, you need to have realistic expectations. There are a lot of patients who need a lot of things. There are a lot of choices. You just got to make sure that the person or the practitioner you see has the experience and has results of other clients that match yours from the beginning and to the end after the procedure. So, if you're thinking about this and you want to talk more about this, I invite you to call my office. You can dial my number at 770-466-4700. I'd be happy to sit down and talk to you about facial rejuvenation. See where we are, see what's reasonable, what's plausible, and what's going to be effective for you. I hope this short podcast really helped stimulate some thinking about PDO thread lifts. Again, I'm not really trying to tear it down, but I think in the long run, if I can just say one thing, or I make that two, it is not what you think it may be. It is not a facelift. It's not the right tool for most people who have sagging skin and sagging muscle who want rejuvenation. Just think of it this way. It's like bringing a kid's hammer to remodel your house. It's just not the right procedure. So, with that being said, I hope you enjoyed this. It's a little bit more informational. Sometimes I get a little kind of kitschy and with other podcast episodes, but I really want to kind of dispel a lot of the myths with this thread lift. So again, I hope you enjoy. Again, if you want to really kind of talk to me, please give me a call. You can follow me on social media. I'm on TikTok, of course. I'm on YouTube or on Facebook. We have an Instagram. You can go to our website, which is www.esjaesthetics.com. Uh, Tour our website, look at our before and afters. I have FAQs about all procedures, minimally invasive or non invasive to surgical procedures. With that being said, I really appreciate your time today. I hope that you have a great, great weekend and look forward to seeing you next week for Plastic Surgery TNA. That's Plastic Surgery Talk and Advice, because I believe as a board certified plastic surgeon, it is my responsibility to spread not only truth, but truth and transformation. Please be safe wherever